Hey everybody, I'm Leslyn Keith with the Lipedema Project. I'm the president of the board and director of research, and I get together with you twice a month to do these research updates with you. There is just so many papers coming out, so much research being done in the area of lipedema. It's impossible to get to everything, but I try to give the most recent papers, the most fascinating papers, the things that might have the most impact for you when I get together with you on this, usually the first and third Thursday of the month, but sometimes that changes depending on what else is happening that month. So I'm here with you today to talk about this paper, the usefulness of the application of compression therapy among lipedema patients, pilot study. And specifically, this is a pilot study because there's only 6 participants. And so it was not meant to show so much cause and effect, but to show that, oh, this is a proof of concept. We should do a larger study on this. And so we don't have definitive results from it, but we have some good information, a good place to start and where we can proceed from there. So it was done by a group of researchers in Poland. And it just came out in January of 2023. It was in the peer-reviewed journal, International Journal of Environmental Research and Public Health. We will have a link below. It is open access, so you should have no difficulty getting to this paper. And I will also, let me just tell you too, that we'll post my email. You saw it earlier when we first started this broadcast, Leslyn@lipedemaproject.org. If you have any questions or comments or the things you'd like to talk to me about regarding this paper or other things that I have done, be sure to email me. And also, I love it when you, like Julie, who just posted, and Kim Maria, who's my neighbor, post that where you are in the world. And I love to know that you're out there listening. Thank you, Julie. So this paper, we have the aim of this paper the aim of the study was to compare 2 methods of lipedema treatment, namely exercise combined with compression therapy compared with exercise only. So that was the 2 interventions they were looking at. And they also wanted to look at the appropriateness of several measuring tools, certain assessment tools, and how appropriate they were for lipedema studies. And they also did make the point of stating in this article that they believe that although compression therapy is not going to reduce the volume of fat cells, of the lipedema fat, there is a lot of evidence that show that compression therapy is beneficial for other symptoms of lipedema. And also, they said that they noticed that there has been no other studies that looked at compression therapy for lipedema without using manual lymph drainage. So this study does not have manual lymph drainage. It has compression therapy and exercise. So how did they get their participants for this study? They recruited them from social media and from a physiotherapy clinic there in Poland. And so in order to be included in this study, they had to be female and they had to have characteristic symptoms of lipedema. I would assume they also had to be there in Poland because part of the stuff had to be done in person. So they then came down to 6 participants and they randomly assigned them to 2 groups. So there was 3 participants in each group. And in group A, that was exercise only. Group B combined exercise with compression therapy. The study lasts for a total of 6 weeks, and they did a variety of assessments before they began the intervention at 4 weeks and then again at 6 weeks. And the intervention included all participants were in an exercise program 3 times a week. Once per week, they were supervised by a physiotherapist, and the other 2 times a week, they were supposed to do it at home. And that was the exercise program. And they didn't detail what the exercises were in this paper, but they did that for the first 4 weeks. The last 2 weeks of the intervention, they were not supervised by the physiotherapist. They were just told to continue to do these exercises 3 times a week at home. And specifically the group B participants, the ones that were getting the combined treatment, exercise plus compression therapy, they were given compression leggings. So, and they were told to wear them at least 12 hours a day, especially when they were active. In the final 2 weeks of the study, participants in both groups were asked to continue the exercises and wearing their compression garments if they were in that group B, and but without any supervision. And then they were also asked to please not change their diet or go to any other physical therapy treatments for the duration of the study, for the 6 weeks. And just a little bit more information on those compression leggings. They were flat knit compression class 2. If you know anything about compression garments, that tells you a little bit more about that. So leggings go from your waist to your ankles, so your feet are not covered. So what measurements did they do in this study? On intake, all participants were asked questions regarding their diet, their lifestyle, physical activity, and their symptoms. And they were asked specifically about symptoms associated with lipedema. And then they did circumferential measures. So they measured the waist, the hips, the thighs, knees, calves, and foot. And they did their weight. They calculated a waist to hip ratio, and they also calculated a BMI. And then they had a subjective symptom severity measure, so a questionnaire that they used for that. And then they used actually ultrasound, and they were measuring the skin adipose tissue thickness. And lastly, they had a quality of life assessment. It's the SF-36. And this has 8 domains that they look at in your quality of life. It has to do with physical functioning, role limitations due to physical health, role limitations due to emotional problems, energy/fatigue, emotional well-being, social functioning, pain, and general health. And so you can see how those things really, they really pertain to someone with lipedema. And so it looks like that was a good tool to look at quality of life. And so, interestingly, none of these participants that they enrolled in this study had been previously diagnosed with lipedema. The authors felt that they did get participants with lipedema because they had a certain number of those characteristics that are associated with lipedema. And so they were looking at disproportionate fat in the lower body, pain, bruising, fatigue, some various other symptoms like that. So I wanted to tell you a little bit about the 2 groups, even though they're very small groups, just 3 people in each group. I wanted to tell you a little bit about those 2 groups, and because they were actually, in some areas, they were quite different. And that's what happens when you have such a small group, is you don't have a similarity between the groups. And so for age, the group A, and again, that was the exercise only group, they were 48 years old. But the group that did combined treatment, they were a lot younger at 31. Could this have impacted outcomes? Possibly. Weight, also the exercise only group was heavier. So they were 104 kilograms, or that's 229 pounds, versus the second group that did the combined treatment. They were only 77 kilograms, or 170 pounds. As far as symptoms, very similar in the groups, but they had 2 of the symptoms, and I just gave you the top 4, the most commonly reported symptoms. 2 of the 4, they had a different distribution, but the other 2 of these top 4, 100%, so all 3 in each group had that symptom. So for instance, heaviness, all 6 participants, 3 in each group, all were experiencing a symptom of heaviness. And then the other one that they all had, the others, they did not. That was the only one they all had. Pain, they had 100% in the group A, or the exercise only, had pain, versus 67% in the other group. And interestingly, their level of pain was different. So the exercise only group, they rated out of 10 being the most severe pain, they had 5.7, versus the other group is only 2.7. So difference in the intensity of their pain. And disproportion, 2/3 in the group A, exercise only, had a disproportion, whereas 100% in the group B did. And group A, 100% had easy bruising, whereas only 2 out of 3 in the group B did. As far as the lipedema stages that they were in and their diet history was pretty much the same, distributed through the groups. And also another interesting difference was that group B, the combined treatment group, had a history of a higher level of participation of exercise than the group A. So all these things, when you look at such small groups, those differences can impact the outcomes. And that's why I say that we didn't so much definitively learn that, some things from this, there's trends, there's things that we can make conjecture on, then we can say, well, let's now do this with a larger group and see if it is definitive. So look at the results. So there was actually a lot of areas in the results that were not significant. The groups were pretty much the same, but there was trends that I'll point out. There were a couple of areas that were significant, but again, the groups were too small. So there was no significant change between groups as far as weight, BMI, or waist to hip ratio. It stayed fairly constant as far as circumferential measures. You remember they measured from the waist, hips, and all the way down the legs. But there were some interesting trends. And the first one I want to talk to you about is menstrual cycle. And this is something Siobhan and I have talked about before, especially when they were looking at blood samples. They were looking at, for instance, hormones, and they didn't note where it was in the menstrual cycle if they were still menstruating, because that could really impact your blood levels of certain hormones. So they found that this also had an impact on their weight and on the circumferential measurement, because we do at certain periods of your menstrual cycle, if you're still menstruating, it can cause some water retention and it can cause your weight to go up and it can cause that circumference to get bigger. And so there was just one participant during week 4 that she said she was menstruating, which I don't know if they even asked the other people if that was something that was going on. And so she had an increase in weight and in her calf measurements. And then on week 6, they were both back down. So we need to make note of those things as that impacts. The other thing that there was a trend was the disproportionate fat. So the group B, which was the exercise combined with compression, there was a tendency of that waist to hip ratio to decrease, while in the group that had exercise only, the waist to hip ratio had a tendency to increase, which suggests that there was less of a disproportion between the upper and lower body in the group that was doing the combined treatment. So I'm hoping that's not too confusing, but it wasn't significant. There was just a tendency for that to be. Another tendency was the relationship between weight and circumference. And so all participants had a tendency to go slightly up in weight. I mean, it was like 1 kilogram, and to go slightly down in body measurements. Both of these were not significant, but they did change in those directions. And it does tell us that maybe a combination of exercise and compression therapy could have an impact in those areas that doesn't necessarily impact your weight, but can ultimately impact the volume of your legs. So the circumferences seem to go with that, but the weight might have gone slightly up, but the circumferences was slightly down. Could be an impact of exercise. Or compression garments. Group is too small, we're not really sure. Let's look also what the outcomes were for symptom severity. Now here, there was some significant differences between the groups that probably would be more easily analyzed with a larger study. But there was significant difference between the groups for impact on daily functioning, bruising, and pain at palpation. Because they had 2 where they looked at just your pain and then what was your pain doing at palpation. And so the group, as you might have guessed, the group that was getting the combined treatment did significantly better than the group that was doing exercise only for each of those areas. And also the group that was doing the combined group also for the swelling around the ankles and a feeling of heaviness in the legs, also much better in the group that was doing the combined treatment. And then lastly, the quality of life measure, that SF-36, both groups did better at the end of the study. But it was even more better with the combined treatments. And so looking at especially for energy and fatigue, so increased energy, less fatigue, better for the combined treatment. And then just an increase in quality of life. Both groups had an increase at week 4, went down slightly at week 6. Remember, that corresponds with less supervision. They were not having the once a week contact with the physiotherapist at that point. Could that have had something to do with it? So that was very interesting. And then the skin thickness and the adipose tissue thickness, they did with the ultrasound. There were no differences between groups and also no differences by the end of the study. So what do they conclude from this pilot study? They conclude, as we probably would have guessed, that compression therapy combined with exercise can be beneficial for improving quality of life and reducing or managing symptoms in lipedema patients. And it seems to have a greater effect than just exercise alone. And supervision may be a key part. Some kind of monitoring may be key to make sure that people are able to adhere. And if they're having difficulty or challenges with adhering, that can be helped by having someone who is monitoring them and supervising them. So it might have an impact on their outcomes. And then everybody did improved in the quality of life measure, the SF-36. It didn't seem to matter which intervention it was. They all improved, but they seemed to have a greater effect, more improvement in the exercise plus compression therapy. And then they decided that seemed to be a feasible tool, that SF-36 looked like a good tool to use in studies. And the circumference on the lower extremity tends to increase without compression. Again, it wasn't significant in this 6-week intervention, but it seemed like it was tending towards increasing. And so maybe wearing compression while actually helping to manage and reduce symptoms, it also might keep you from getting and growing in size and getting larger. And then ultrasound should be considered as a evaluation tool because it did seem to monitor that even though there wasn't any differences in this study. What are the limitations? So of course it needs a larger study and so more participants. And even though the participants were asked not to change their diet, some still did during the study. And that needs to be noted because that can impact the results. And they stated again, make sure you put the phase of the menstrual cycle because that can impact the results. I would also suggest one other thing. They kept referring to these two groups as Group A and Group B. And I had to keep flipping back and going, okay, which one was Group A? Which one was Group B? So having a label for the group combined versus exercise only or something would be much more helpful to the reader going through the study. So I'd have to keep flipping back to remind myself what was Group A and Group B. That would really be helpful to the reader. But I think that overall, this is a great study, a very nice paper. It's not, like we say, definitive because of the limitations of the study, but it does show that a trend towards combining exercise with compression, or really, what we do at Lipedema Simplified is a holistic treatment. There is not a single intervention that you use to manage lipedema. It's best to combine several different interventions, and this showed the value of combining exercise with compression therapy. And it also, they did assess several tools for assessing lymphedema, and they felt like the ones that they used would be good for future research. So that was really good. Just so you know, too, that I do flash briefings. It's our little mini podcast that we do through Lymphedema Simplified. And these reports about the different papers also show up there. So if you go to lymphedemasimplified.org/flash, you can find an archive of all of the flash briefings. You can sign up to just automatically get all those flash briefings. And so periodically you're going to hear the little mini podcast where I discuss these papers. So that's a good resource for you. And then I wanted to just give you one announcement, then I'll look what their comments are in the chat. So we do have a free webinar coming up this Saturday, November 4th. It is pelvic floor health with Angeline Petersen. She's a physical therapist, a pelvic floor therapist, and she's going to be talking this Saturday at 5 p.m. Eastern time. And so, it's talking about those pelvic floor issues, that if you're having frequency issues with urination or little leaks, or having to get up several times a night, or urgency issues, all that kind of stuff that can happen as we age, or with trauma or surgeries or various things can impact our functioning. It's a really good webinar. I highly recommend you check that out. We'll have the information in the link below to find out more and just to sign up for that. And now, really quickly, I did see some comments over here. Let's see what we got. Hello from the UK, Fractal Beans. I'm not sure who that is. Barb from South Carolina, and Gloria from North Ogden, Utah. It's sunny but a little bit cold. I'm not sure if I pronounced this right, but Gletta, maybe. Hello from Norway. Nice to have you here. And Gloria says, I would be interested in a test that added the use of compression therapy, such as the tactile garments and compression. So, and you're absolutely right, Gloria, because compression therapy is kind of a bigger box than just garments. And pneumatic compression pumps, or actually there's now some non-pneumatic compression pumps, but those pumps are part of the compression therapy box. So yes, that would be interesting to combine those two treatments and see a study on that. I think that I've seen one come out with exercise with a pump, but not with garments in a pump. That's a good point. And then Lisa is here from Iowa, and Aaron says, has anyone found compression wear that easily fits under clothes? That's an excellent point. Just donning your clothes sometimes over a stocking can be like it sticks to the material. And there's some very nice textured fabric garments that are very good for lipedema, but they can kind of grab your clothes as you're trying to get your clothes on. And if that's what you're talking about, maybe fits easily, but also is easy to don. I'm thinking of the Wear Ease compression capris, because it's kind of a spandex lycra kind of a garment that's very smooth and things kind of slide over it easily. You might check that out. Wear Ease is a sponsor of a lot of our events, and we really like their products. So that's something to think about. And then Marcia says she's here from Texas. Thank you so much, everybody, for being here with me today. I always enjoy discussing things with you and bringing you the latest that's happening in research. Contact me at Leslyn@lymphedemaproject.org, and I will see you next time for another research